मन में बहुत द्विधा है। हर्निया कॉमन प्रॉब्लम है, मतलब अम्बिलिकस के पास में हो सकता है, सिजेरियन कोई भी सर्जरी पेट का लोअर एब्डोमेन में लेडीज की होता है, उसके बाद हर्नियास बहुत कॉमन है। और ऐसा भी है जब तक बहुत बड़ा नहीं है लोग उसको कुछ नहीं करते। और आता है इंग्विनल हर्निया, तो ग्रोइन के पास में जेंट्स को ज्यादा वो हर्निया होता है एज दे ग्रो ओल्डर और दे यूज एक्सेसिव जिम, आजकल वो फैशन है। तो ये जितने सारा पेट में हर्नियाज होता है, मेजॉरिटी ऑफ सर्जन्स नाउ हैव लर्नड हाउ टू डू लेप्रोस्कोपिकली। दैट मींस छोटा होल्स करके पेट के अंदर जाके वो डिफेक्ट को क्लोज करके एक जाली और मेश डालते हैं। विद द एडवेंट ऑफ रोबोटिक सर्जरी एक ही क्वेश्चन आता है, जब सर्जन्स इतना एक्सपीरियंस्ड है और लेप्रोस्कोपिकली लेस प्राइस में सर्जरी हो जाता है, तो रोबोटिक की क्या जरूरत है? It is tough also. The surgeons have learned so much to expertise in doing laparoscopic hernia surgery. Why do they have to unlearn? Why do they have to learn something different to do the same type of procedures? And that too, which is more costly, which needs the hospital to keep a robotic instruments, robotic system, which is a bigger buy for the hospital. So overall, that might cost more to the patients. वो मेरा मन में भी वही सोचना था। When we started doing robotic surgeries, we started doing few cases like umbilical hernia or easy uncomplicated hernias robotically. तब मेरे को भी लगता था इसको तो हम laparoscopically कर सकते थे, क्यों कर रहे robotically? But we saw every patients who underwent a robotic surgery, in 2 hours they get rid of their anesthesia, they want to go back to the room, they walk, they pass urinarily, there is almost no pain. So many have told us, did you really do a surgery to us? This is not a marketing gimmick, this is truth. So majority are pain free in 2 hours or maximum 4 hours, and after that they go to the room by the evening and they go home next day. That can happen in laparoscopy. The pain will be definitely more than robotic systems. Second thing is suturing. No doubt, people have learned over years how to suture laparoscopically, but the same thing can be reproduced robotically much more easier. There is a saying, robotic instruments makes even a average surgeon a extraordinary surgeon. To coming to the point, any surgeon who practices a robotic system can reproduce the quality of work which is done by an extremely experienced surgeon. So which in turn makes much more patients accessible to a better health care. So suturing is better, placing a mesh is better, doing difficult cases 3-time, 4-time hernia repair you are doing next time is much better with the 10-time magnified image, better precision, knowing the anterior abdominal wall much better. So over a period of time, in our experience also, much more patients, they are asking for a robotic surgery because somebody get cured, pain-free, scarless, even in very difficult cases. So the message is very clear. Maybe the robotic instruments might cost a little more, but it will go a long way in avoiding a recurrence of a hernia, in having much lesser pain and earlier return to your work. So what do we want? We don't want to stay in the hospital with pain for more time. We don't want a recurrence. The most important is recurrence. दोबारा नहीं होना चाहिए. Definitely, I can tell you, with robotic platforms, we can do, any surgeons can do a much better justice to any hernias compared to laparoscopy. So I wish more and more surgeons get access to robotic systems and get trained in it so that more and more patients get the benefit out of it. Thank you so much.